This video will provide an introduction to substance use disorder in general, including the epidemiology, etiology, and general pathophysiology of the condition. Subsequent videos in this unit will focus on individual substances, their addictive properties, their withdrawal syndrome, as well as potential treatment options if those exist. We'll start with the epidemiology of substance use disorder. But before we can get to substance use disorder, it is first useful to consider how many people in the United States use any substance that's considered addictive. The data on the next several slides comes from the National Survey on Drug Use and Health, or NSDUH. This is a nationwide survey conducted by SAMHSA each year that measures indicators related to drug use and behavioral health. To start with, let's just look at people that use any substance. The figure here is showing substance use among people aged 12 and older in 2018 who used any of the listed substances at least once in the past month. And as you can see, when you ask that question, many of the individuals who responded to the survey have used one of these substances in the past month. In addition, keep in mind that some of these substances, although addictive, are illegal. So out of the total population surveyed, about 109 million people, or 40%, reported no past month use of any of the substances listed, whereas 60%, or the majority, reported past month use of at least one of the substances listed. What substances are people using? By far and away, the most common substances used are the legal substances, alcohol, and tobacco. This is closely followed by the use of marijuana, which in many states is legal either for medical purposes and or recreationally. Next comes prescription pain relievers, followed by cocaine, and then several other illicit or illegal substances. Next, let's look specifically at illegal substance use. This data comes from the same survey and is now looking at illicit or illegal substances only. This graphic is showing past year illicit drug use among people aged 12 or older in 2018. And among all of those surveyed, about 53 million people, or just shy of 20%, used any of the illicit drugs listed at least once in the past year. So when we look just at illegal substances, the majority of individuals surveyed are not using these. Of those that are, the most common are marijuana, prescription pain relievers, prescription tranquilizers or sedatives, hallucinogens, cocaine, and prescription stimulants, including ADHD medications. Finally, if we narrow down even further to not only people who have used one of the substances, but people who have a likely or documented substance use disorder. This figure is showing people aged 12 or older that had a substance use disorder in the past year in 2018. And again, as you can see, the vast majority of people surveyed did not have a past year substance use disorder. Upwards of 250 million people, or 94% of those surveyed. However, approximately 8%, or 20 million people, did have a past year substance use disorder. Of those with a substance use disorder, most commonly this was around alcohol, and then this is closely followed by any illicit drug, which includes all of the illicit drugs combined. So alcohol is by far and away the substance with the highest incidence of substance use disorder. Marijuana is the one with the highest incidence in terms of the illicit drugs, followed by prescription pain relievers and then methamphetamine. Not shown on this graphic is substance use disorder or addiction related to nicotine, and that includes smoked, chewed, or any other form of nicotine. The use of nicotine is very prevalent, and this would be right up there with alcohol. When we're talking about substance use disorder, it is helpful to start with a few definitions. First is tolerance. Tolerance is the phenomenon where dose escalation is required to maintain the desired effect of the drug. Almost all drugs of abuse produce some form of tolerance, whereby the user has to increase the dosing in order to maintain the desired euphoric effect. Dependence is an altered homeostasis in which there is a withdrawal syndrome upon abrupt discontinuation of a drug. Dependence is usually visualized or observed as a withdrawal syndrome. So essentially, dependence and withdrawal go hand in hand. Again, almost all drugs of abuse produce some form of dependence. However, it's important to keep in mind that dependence is not always correlated to drug abuse because dependence can occur with non-psychoactive drugs like beta blockers. Finally, addiction is a condition in which there is compulsive, relapsing drug use despite negative consequences. As the epidemiological evidence has just demonstrated, this occurs only in a subset of substance users. Not all users become addicted, even if they've used a substance that is highly addictive in the past month or the past year. Once addiction does occur, relapse is common and problematic. Again, almost all drugs of abuse are able to produce an addictive state. The molecular mechanisms underlying tolerance and dependence are fairly well characterized and are the result of simple molecular changes at the receptor and intracellular level. This graphic demonstrates those changes that occur during tolerance and dependence using morphine as an example. When morphine is being given, as evidenced by the green bar, there is a continuous upregulation of some intracellular signaling proteins, such as adenyl cyclase and protein kinase A, and an initial downregulation of other intracellular signaling molecules like cyclic AMP. However, over continued morphine administration, that initial decrease in cyclic AMP levels begins to reverse toward normal baseline levels. And this is the body responding to the continued presence of morphine in this altered homeostasis or dependence state. Upon abrupt discontinuation of drug, or in this case, administration of an antagonist like naloxone, you see a phenomenon known as cyclic AMP overshoot, which is when morphine is abruptly removed, the body responds by greatly increasing cyclic AMP levels as an inverse of the effect that had been happening previously. And it is this cyclic AMP overshoot or large increase in intracellular signaling cascades that leads to the symptoms of withdrawal. In general, the neurobiology of addiction is very well characterized and involves a specific dopaminergic pathway known as the mesolimbic dopamine system. The mesolimbic dopamine system, which is indicated in this figure by the number 2 neuronal pathway, originates in the ventral tegmental area in the brainstem and projects to the nucleus accumbens in the forebrain, as well as to other brain areas. This pathway is activated by all drugs of abuse, and all drugs of abuse increase dopamine output or dopamine release in the nucleus accumbens. There are 3 other dopamine neuron pathways in the brain: nigrostriatal, mesocortical, and tuberoinfundibular, but these are important for other disease states and not as much for substance use disorder. Though the molecular mechanisms of tolerance and dependence are well characterized, the molecular mechanisms of addiction are more complicated and less well known. The best way to describe addiction is that it is a form of maladaptive learning, and it includes several brain areas involved in the normal learning process, such as the hippocampus and the prefrontal cortex. In the case of addiction, there is commonly the motivation to use a drug despite negative consequences, and this is often described as wanting a drug without liking it. Individuals who are addicted to a substance also have a high risk of relapse due to many factors, such as drug-associated stimuli or context-dependent stimuli and stress. These environmental factors activate parts of the brain involved in the molecular mechanisms of addiction that then lead to the release of dopamine in the nucleus accumbens and the eventual relapse of drug taking. One important thing to note is that the features of substance use or addiction are shared by many behavioral compulsions, such as shopping, gambling, or sex. And that is because all of these compulsions or addictions activate this same pathway in the brain, the mesolimbic dopamine system, causing the release of dopamine in the nucleus accumbens. The other important aspect of addiction to keep in mind is that there are large individual differences in the susceptibility to substance use disorder, and that is in large part due to genetic differences at baseline. Some individuals are highly susceptible to developing addiction or substance use disorder, whereas other individuals, even if they tried the same substances for the same period or length of time, would not develop a substance use disorder. And again, that is primarily due to genetics. As I stated earlier, all drugs of abuse increase dopamine release in the nucleus accumbens. Because there are some drugs of abuse that do not cause dopamine release in the nucleus accumbens, these agents are sometimes known as non-addictive substances. The non-addictive part could be a little bit debated, but essentially these are substances that alter perceptions but do not cause euphoria because they do not cause dopamine release in the nucleus accumbens. Rather, these are drugs that target corticothalamic neurons or cortical and thalamic circuits to influence perception and visual function. These non-addictive substances are drugs like hallucinogens like LSD or dissociative anesthetics like ketamine that still can cause long-term effects like flashbacks or an irreversible schizophrenia like psychosis, but are typically thought of as non-addictive because of the lack of dopamine release. This is a primer to the specific agents we will get into discussing in terms of substance abuse. These agents can be divided into three classes, class 1, 2, and 3, depending on their mechanisms of action. The subsequent videos will touch on specific drugs within these classes, discussing their mechanisms, acute effects, withdrawal, and also their treatment if that is relevant. The class 1 agents are drugs that activate G protein coupled receptors in the ventral tegmental area. And these are drugs that fall into the opioid class or drugs like THC and GHB. By activating G protein coupled receptors in the VTA, these drugs produce what is known as GABA disinhibition that allows these dopamine neurons in the mesolimbic pathway to be activated and release dopamine in the nucleus accumbens. The class 2 agents are mostly ion channel activators like benzodiazepines, nicotine, and ethanol, and these also act in the ventral tegmental area to activate dopamine projection neurons and subsequently cause dopamine release in the nucleus accumbens. Finally, the class 3 agents are the stimulants like cocaine, amphetamine, methamphetamine, and ecstasy. These drugs primarily act directly in the nucleus accumbens to inhibit the reuptake of dopamine, thereby leading to enhanced levels of dopamine in the synapse in the nucleus accumbens. We will get to each of these classes in subsequent videos and go through individual drugs as they arise. Based on what you've learned so far, take a moment to list some variables, also known as etiologic factors, that might contribute to continued drug taking and the development of a substance use disorder or addiction. Take a photo of the QR code for some help answering this question.